the CLASICC Trial, Insights into Laparoscopic versus Open Surgery for Rectal Cancer. Welcome to today's episode, where we explore one of the landmark studies in colorectal surgery, the conventional versus laparoscopic-assisted surgery in patients with colorectal cancer trial, better known as the CLASICC Trial. We will focus on its pivotal findings regarding rectal cancer and discuss the significance these results have had in shaping surgical practice. Introduction and objectives. The CLASICC Trial was a large, multi-center randomized study conducted in the United Kingdom. Its primary purpose was to compare the clinical and oncological outcomes between laparoscopic-assisted surgery and traditional open surgery for patients diagnosed with colorectal cancer. While the study involved individuals with both colon and rectal cancers, its insights into rectal cancer management have proven especially influential. Study population. In total, 794 patients with colorectal cancer participated in the trial. Of particular interest, 381 patients with rectal cancer were randomized to receive either laparoscopic surgery or open surgery. This robust subgroup allowed for a focused analysis on the unique challenges and outcomes in rectal cancer treatment. Key findings. Focus on rectal cancer outcomes. Let us begin by examining the short-term, or perioperative, results. Laparoscopic surgery, while requiring a longer operation time, led to a shorter hospital stay compared to the open technique. Post-operative complications, as well as 30-day morbidity and mortality rates, were similar between both groups. Early assessments of quality of life favored the laparoscopic approach, with patients experiencing a speedier return to normal activity. Turning now to oncological outcomes, the trial followed patients for up to 5 years. Most notably, there was no statistically significant difference in overall survival or disease-free survival between laparoscopic and open surgery for rectal cancer. However, the trial did observe a non-significant trend toward higher local recurrence rates in the laparoscopic group compared to the open group. Specifically, the 5-year local recurrence was 11% for laparoscopic surgery and 7% for open surgery, though this difference did not reach statistical significance. A particularly important finding was related to the circumferential resection margin. Essentially, the distance between the tumor and the edge of the tissue removed during surgery. A clear margin is vital to reducing recurrence risk. The rate of positive circumferential resection margins, indicating a tumor within 1 mm of the cut edge, was higher in laparoscopic cases. This was most pronounced among patients whose operations had to be converted from laparoscopic to open due to technical difficulties, with converted cases showing a notably high rate of involved margins. Conversion and surgical decision-making. The trial highlighted that a significant proportion of laparoscopic operations, over 14%, required conversion to open surgery. Among these converted cases, the rate of positive resection margins was markedly elevated, suggesting that tumors which were technically challenging to remove laparoscopic were also more likely to result in an incomplete excision. Summary and implications. In summary, the CLASICC Trial demonstrated that laparoscopic surgery for rectal cancer is feasible and offers short-term benefits, such as a reduced hospital stay and improved early quality of life. Nevertheless, the study raised caution regarding oncological safety, particularly in cases where achieving a clear margin is challenging. The trend toward higher local recurrence and increased positive margins in the laparoscopic group emphasized the importance of surgical experience and judgment. Surgeons were advised to convert promptly to open surgery when faced with technical difficulties, rather than persist with a laparoscopic technique that risked oncological compromise. Legacy and influence. The findings from the CLASICC Trial played a significant role in guiding future research and surgical protocols. It underscored the critical importance of surgical expertise and the need for comprehensive training in laparoscopic techniques. The trial's cautionary insights laid the groundwork for subsequent studies, such as the Color 2 and Korean trials, which further investigated the safety and efficacy of minimally invasive approaches to rectal cancer. Thank you for joining us for this deep dive into the CLASICC Trial. Stay tuned for more episodes, where we continue to analyze the evidence that shapes modern surgical practice. It's the Everything Surgery Podcast. Dissect the extraordinary.